like I had summer plans to work in hospital, but they were obviously canceled due to the danger that corona poses. I haven't had any appointments or any need to have any appointments since COVID started, but my doctor did tell me if I were to have one, that it would be virtual. There have been a bit of financial losses due to people being unemployed. My parents specifically was not unemployed, but was given less hours. So I've had to work to make up for anything lost, and we've been able to get food all right.
Pero actualmente aquí en Colombia se ven muy afectadas las personas del sector agrícola, del sector agropecuario, ya que el impacto ha contribuido a que no hayan personas que trabajen para la recolección de la materia prima, que acá en mi sector es el café. Esto también ha afectado mucho el sector a nivel económico, ya que los insumos, abonos y demás productos que utilizamos para la producción de estos alimentos han tenido una alza en el precio, lo cual afecta o nos impide poder comprarlos y poder mantener nuestros cultivos.
You know, when there's a lockdown, we cannot access many things. For example, you cannot move to go to the health facility, because in Africa, or in Uganda in particular, people rely a lot on public means, where you have these buses, you have these mini buses, you have taxis, you have the piki-piki, these motorcycle, border. So they were all not operational. Now, when you fall sick and you don't have your own means of transport to go to the hospital, there you cannot access the hospital. And even worse in the night, because at night there's a curfew which doesn't allow anyone to move. So you have to stay home and wait until the next morning, then you go to the hospital. Another challenge was also the business owners tend to inflate the prices of the products that they have, because now there was no transport to bring the item from Kampala to Gulu. So that means they were selling only what was there in the stock before the lockdown. And they now see that since the demand is high, they would increase the price. For instance, a packet of salt used to be 1,000, but during the lockdown, it went up to 3,000, one packet of salt. So that made it really very difficult. So here now is a matter of survival. People just want to spend on things that they would eat. Like if you get money, you think about stocking your house, maybe with beans, posho, salt, something like that. You cannot really think about other needs like clothing. Even if you think about them, you cannot get them because all the shops that deals in those items have been closed during the lockdown.
अनि यो कोरोना भाइरसले तिम्रो स्टडीलाई चाहिँ कतिको इफेक्ट पारेको छ?
स्टडीलाई त धेरै इफेक्ट पारेको छ, किनकि अहिले स्कुल जान नि पाउँदैन लकडाउनले, तर पनि अनलाइन क्लासले एकदम हेल्प पारेको छ, धेरै हेल्प गरेको छ।
अनि कतिको बाहिर घुम्न जान पाइन्छ त?
धेरै त पाइदैन, तर कहिले कहिले पाउँछ, अनि गयो भने मास्क लाउनु पर्छ।
I am Mohammad Sulaiman Wasan, working in government department at Karachi. COVID-19 has badly affected us in different ways. Whenever I go to my office and when I return to my home, I feel so much in a very difficult position that how I meet my kids or my parents because this COVID-19 is so much increased in our city and in our society. And in offices, whenever customers visiting our offices, or even though our colleagues are meeting with us, we feel so much fear that if someone from them is affected from COVID, then what will be with ourselves and with our parents or with our home?
For every student, it was very much difficult because there were no physical classes being conducted in any institute. If there were any physical classes being conducted, then due to the COVID fear, every student was in like mental trouble, that whether we should enter in class or not, we should take the class or not. And after, if the student who preferred to study from his home, like online class, there were too many problems, especially in underdeveloping countries like Pakistan, where the internet connections are very big trouble for any of the students living in especially not richer class or what we say business class areas.
On the other hand, into the health infrastructure, it also affected. You know, like the hospitals, the doctors were in fear whether they are actually, you know, every person saw, and we have seen that a lot of doctors into the world died because of the COVID. So the doctors community came under the pressure and the fear. Therefore, they stopped, you know, doing OPDs, routine OPDs into the hospitals. And by that, you know, the patients suffered a lot. The patients who actually required health facility and health care for any other reason other than COVID, they were actually deprived of that health care. So I think the people suffered a lot here because of COVID, but not due to the COVID.
It make me more difficult than I'm studying in university in school, and it's different. It's really different from here in the house by online, because sometimes we cannot ask the teacher all the time.